Hello everyone, here I have another sciatica video for you guys. I'm going to go over the case, give you guys a second to think about what kind of sciatica fracture this could be, and then I'll go over what type it is and why. So in this case, the patient fell off of their electric scooter and sustained this tibial plateau fracture to their right leg. So you can see here that there's been a break-off of the lateral tibial plateau component along with the medial tibial plateau. And what's interesting about this case is that there's also this transverse metadiaphyseal fracture happening here, which is pretty rare. And if you look at this fracture from another view, you can also see the fracture lines here, 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 and also here as well. You can kind of see it coming in. And here is also a CT3D reconstruction of the injury, where you can see there's just a lot of breakup happening with pieces coming off here and here and here. So I'll give you a second to think about what kind of fracture this is. Comment down below if you think you know the answer. Okay, so for those of you who said sciatica fracture type 6, you're correct. Congrats. The reason that you know it's a sciatica fracture type 6 is because of this transverse metadiaphyseal fracture happening here. Whenever you have a fracture happening like that, along with the lateral tibial plateau being broken or the medial tibial plateau, it's going to be a sciatica fracture type 6. These fractures, because they're such high energy, are rarer than, say, type 2 sciatica fractures, so you won't see these ones as commonly as the lower energy ones like 2. And this patient actually had to have an external fixator followed by a 4-compartment fasciotomy just to release the pressure from the injury because it was so severe. And then they were able to do ORIF, fortunately. So yes, thank you for watching. Please feel free to watch other videos as well. Bye.